welcome to the members rejoining online and to those members of the public watching online. We now move to item 7, the 6th Local Child Poverty Action Plan, and the Deputy Provost is going to take this item and item 8.
Thank you, Provost, and good afternoon. And having had the paper introduced, I'll go straight to Greg Boland to introduce it, please. Thank you.
Good afternoon, councillors. The Local Child Poverty Action Report 23-24, which is a statutory requirement, serves as a critical reflection of the ongoing efforts of Perth and Kinross Council, NHS Tayside and our partners as we try to address child poverty across Perth and Kinross. The report outlines the collaborative approach taken to implement Child Poverty Delivery Plan, aligning with the Scottish Government's broader strategy, Best Start, Best Futures. Child poverty remains a pressing issue, with approximately 22% of our children in Perth and Kinross living in poverty, a statistic that has shown relative stability in recent years. This report not only highlights the challenges faced, but also emphasises the importance of a right-based approach, as articulated in the UN Convention on the Rights of the Child. Through a comprehensive framework and incorporates the Getting It Right for Every Child approach, this report This report not only highlights the challenges faced, but also emphasises the importance of a rights-based approach as articulated in the UN Convention of the Rights of the Child. Through a comprehensive framework that incorporates Getting It Right for Every Child approach, this report aims to enhance outcomes for children and families by ensuring timely access to necessary support services. It also aligns with No One Left Behind, which emphasise the need for targeted employability support for parents, thereby fostering a sustainable path out of poverty. The report also outlines the progress made, the areas requiring further attention, and the innovative practice being implemented to combat child poverty effectively. The insights gathered here will inform future strategies and reinforce our commitment to creating a supportive environment where every child can live and thrive. The report is accompanied by the latest Children's Scorecard, an innovative approach to measure the effectiveness of our approach, and one that has been recognised as national best practice by the Scottish Poverty Research Unit. Together, I hope these documents illustrate the continued hard work from our partners, including NHS Tayside, and mitigate the worst challenges of poverty within Perth and Kinross. Thank you, Deputy Provost.
Thank you very much for that introduction. Are there any questions? I see none on the screen at the moment. Yes, Councillor Freshwater, thank you. No, sorry, that was my eyesight failing me. Councillor McEwen, thank you.
Thank you, Deputy Provost. Within the Child Scorecard appendix, it's part of the paper. There's a description of income, which although we've discussed that earlier in the council, but the issue I'd like to raise, and I have raised this with officers, is that Blairgowrie as an area, which includes Rattray, is included as a single entity. I'd like to hope that going forward that data can be collected in such a way so that Rattray and the Glens can be described differently, because I think there is demand there that, and maybe this average figure for the whole of the ward actually doesn't give justice to the actual demand in the area.
So, Councillor McEwen, yeah, happy to look at that as we move forward, yes.
I was just going to respond, Councillor McEwen. Yeah, that is just the wards. Yeah, that's just the wards in their entirety. We can break that information down to different data zones within that locality. It's just for if we were to do that, that it would be quite an extensive document. But I know Councillor Donaldson from Creef, who broke the figures down to South Creef, North Creef and etc. So we can provide that information just for the purpose of the report. It's quite difficult to show everything here.
You know, the reason I mention it because places like Alyth and Cooperangus, both in the same ward, much smaller than Rattray and Blairgowrie, are described individually. And we know there's demand in Rattray. We know that from other measures. So that's specifically why I mentioned this. It seems to have been done other places, but not for Rattray. And as a ward member there, and I'm sure my ward colleagues will share this, that we need to know, and that helps guide the development trust, the Blairgowrie and Rattray Development Trust, into who to support in the community as well if we support them with this type of information. Thank you.
Thank you. Councillor Donaldson, Stuart.
Thank you, Deputy Provost. After the kind of the last outbreak in the system, I'm almost hesitant to ask a question, but here we are. In many ways, I want to follow on from Councillor McKeown. Income's an important is not the sole determinant of poverty, but it's an important indicator. Statistics do matter, and really, what Councillor McKeown is asking. I'm just looking pages 109 to 111. Point one, I really don't see what we're achieving by showing in page 110 mode income, other than the fact it kind of indicates Murthley is the place to be in Perth and Kinross. But, you know, we've got a whole range of figures there, but in fact, they're all mainly clustered around two values. I don't think that proves anything. Come back to median income, though, on page 109. And this matters, and it's not just Blairgowrie and Rattray. I'm not even going to mention Creef and Comrie here, but it's Perth City, effectively a third of our total population. We've got that broken down: Letham, Bridgend, and then Perth. And maybe it's the way we do the data sets, but on Perth City, I'd have thought there's a requirement to be able to drill down a bit more on that. So we know that parts of the city where there are issues of poverty and others where it's rather less so.
I wonder if Paul Smith could just come in there to respond to Councillor Donaldson.
Yes, happy to, Greg. And thank you, Councillor Donaldson, for your question. This data comes from the khaki paycheck data, so we don't have control over the areas that they break it down by. But what we do have is our locality profiles, as I mentioned in one of this morning's responses to questions. So I think going forward, it might be more useful if we take some of the data from our locality profiles, because local knowledge would say that those aren't possibly the best groupings. It's just that's the way the data was presented to us. That's how it's available to us. But it's back to that point about the SIMD data, that it's too broad brush in these areas. And to Councillor McEwen's point as well, you know, Rattray and Blairgowrie are distinct and different, and certainly recognise that. So I will take that as a set for future reports, that we'll maybe present that data slightly differently, and we'll use our own groupings and our own locality profiles to produce some information rather than relying on the khaki data.
Thank you, Paul. And statistics do matter because they inform and guide our decisions. And I think it's a question here of to what extent we can take a targeted, more rifle approach on tackling some of these problems. It's no perfect solution, but yeah, thanks for your response.
Thank you very much. Bailey, Alistair, thank you.
Thank you, Deputy Provost. My question is also about statistics, what a fun day we're having. My question is about the typeface used in section 3.1. The word estimates is emboldened there, and I was wondering why that is. And I suppose it's leading me to ask, what are the margins for error in the statistics presented in that paragraph? Because if they are estimates, presumably we would know how far out they may be in a positive or negative sense. Thank you.
Maggie Lynch will come in there, please.
Yeah, thanks, Councillor. So, the word estimates is emphasised because what we're talking about here are different measures of uncertainty. So the Scottish Government figure, which is the one that we tend to use when we talk about the number of people or the number of children below the poverty line, the bandwidth that the Scottish Government quote is between 19% and 30%. And they say that it's kind of it's a 95% accuracy, that the midpoint of that is where it lands. But I mean, that is a broad bandwidth, and it's an issue that we're taking up with the Chief Statistician in the Scottish Government to say that we really need to get to more robust data around measuring child poverty for everybody's sake. The other, and I don't know about the CACI data, what the measurement of uncertainty for that is. CACI paycheck data is taken from the DWP, and they do a household survey, and then that is then adjusted for each locality. So, but I could go and find out, and I'll do a memo that indicates what the measurement of uncertainty is for each of the different measures that we're deploying. The reason I put them all on here is that they tell a story. It's almost like if you triangulate your data sources, and they're all broadly telling you that, you know, broadly speaking, 1 in 5 people in Perth and Kinross are in poverty, then you can be reasonably certain that that's you know, you're on solid ground.
Great, thank you for the background, thanks.
Thank you. The mention of CACI there triggered a frisson of worry in me for a moment, but there we go. Councillor Rebek.
Yeah, thanks, Deputy Provost. It's just a very quick question, as a matter of fact, because the report's really good again, and it mentions the importance, quite rightly, of pupil equity funding and Scottish Attainment Challenge funding and promise money. But I don't see in the report, if it's there, I apologise, I've missed it. I didn't see what the totality of that funding was. I'm wondering if anybody knows, please.
So, Councillor Beck, can you just clarify? I think my colleague Sheena Devlin's going to step in here. Thanks. Thanks, Sheena.
There's a range of different sources in terms of money that comes in through the School Attainment Challenge funding, Councillor Rebek. So for what's called SEF, so Scottish Equity Funding, Perth and Kinross Council for 23-24 got circa £500,000. In terms of for looked after children and young people, care experienced children and young people, that was about £240,000. So the total that came into central teams was about £750,000, and the total amount of PEF that's allocated, of course, directly to schools is 1.8 million approximately. Thank you.
Thank you.
Thank you. Councillor Allen. Keith.
Thank you, Deputy Provost, and thank you to Greg and team for the report. Doesn't matter how you look at it, there's a lot of good stuff in here, but it doesn't make enjoyable reading. On page 75, when we're looking at insights from our service responses, when it says here what we could do better, it says there is work to be done to shift resources and actions upstream to provide earlier interventions. Can you maybe just explain what happens just now and what moving things upstream will do? Thank you.
Margaret will come in, thanks.
Yeah, so if you look at where our efforts are deployed at the moment, and it's contextualised by coming out of the pandemic and the cost of living crisis. Most of what we're doing is at the emergency, end of intervention. It's when when families are children are experiencing crisis related to financial difficulties. And what basically the Child Poverty Delivery Plan is aiming at is moving beyond that. So it's not just connecting a family to welfare rights, although that's supremely important because they get the crisis grant. It's about looking at what else the family might need, what the family's capacities are to enable them perhaps to engage with their employability offer, to engage with the range of mental health and wellbeing offers that we have, that is looking at shifting the family from, if you like, cyclical crisis into more sustainable livelihoods.
Yeah, I maybe partly got what I was looking for there, but when you're talking about moving actions and resources upstream, I'm trying to understand what you mean by upstream. Are we going to be doing something different to that we already do just now?
Yes. So the SPAN programme is about using social needs screening and data-driven approaches to identify families earlier and children earlier. So, I mean, typically now we might engage with children when they come to school. We're going to push that right back and work much more closely with health visitors so that when women are pregnant, for example, they're all offered a kind of welfare rights check. They're offered access to a range of services and support around mental health and well-being, that as parents have got children within an early years service, for example, what the SPAN programme will do will assist those parents to take up employability offers while their children are in early years education, so that by the time the kids are going to primary school, the parents are ready to step into work. So moving it upstream is about earlier intervention. It's about trying to get to families and who are at risk of being affected by poverty at the earliest possible stage, and wrapping a resource around about them that's tailored to the specific needs and capabilities of that family, because as was mentioned earlier on this morning, they're all very different.
Thank you very much. And now, Councillor Harvey, Ken.
Thank you, Deputy Provost. A very brief question again. It's an excellent report, but a very brief question on the median income by settlements in Appendix 2. I noticed that purely parochial point perspective, Invergowrie seems to be missing. Is that included with an arrow, or is it an omission? Thanks.
These statistics are provided by CACI, and they're a direct lift from a CACI report. So if they're missing here, they were missing there. But we can let CACI know that there's an error and see if, I'm sure they'll correct it and we can update it as necessary.
Okay, that'd be great.
Thank you. And now, Councillor Duff. John.
Thank you, Deputy Provost. My question's on page 60 of the report, and right at the top of the page, there's a fairly bald but important statement. It says, where we could do better, the gender pay gap rose to 15.6% from 13% in 2019-20. I think that's very disappointing that 5 years on, we've nearly a kind of 3% increase in the wrong direction in terms of the pay gap. But also, could we clarify, I take it this is a Perth and Kinross figure, not a council figure, and what more can we do to deliver reductions to this difference in gender pay? Thank you.
So Councillor Duff, is a Perth Cross figure, and Margaret will just come in there about what we're going to do as part of taking forward the poverty strategy.
Hi, so one of the things that we can do is to encourage women into work that pays well. So that's about removing the barriers that women face around childcare and transport in terms of taking up offers which are about either building their skills and confidence levels, or indeed enabling them to take up the offer of paid employment. It's a fact of life that women's employment tends not to be as well paid as men's, you know, and that's a broader issue, not one that is within our purview, but we can certainly work closely with our colleagues in the employability team to support women into work that pays fair, you know, a fair wage, and that has the prospects of progress, of progression.
And so just for clarity then, this isn't obviously an equal pay issue. This is just the fact that the types of employment that women tend to have is lower paid employment, rather than there being a difference between paying a male and a female a different rate for the same job.
Okay, so it's well, it's illegal to pay men and women differently for the same job. It's more to do with the sexual segregation of the workforce by sex, where women tend to be concentrated in, for example, retail, health and social care, which are at the lower, you know, at the lower paid end of the spectrum. And a lot of this is about building women's skills, in, you know, so that they're able to work across all sectors of the economy, and not just in those areas that are, you know, kind of blighted by low pay and insecure employment.
Right, thank you.
It's also a function of women's role as child carers and carers, where women don't, you know, women tend not to be able to work the same amount of hours as men because they are the primary carers for either children or older folk.
Thank you. Councillor McCall, Sheila.
Thank you. Thank you very much. While Councillor Duff got in ahead of me on this particular topic, I do have a question that in the action plan going forward, there doesn't seem to be anything specific in addressing the gender pay gap, even though it's highlighted throughout the report and the papers on an area where we could do better. So I'm just wondering if there are any specific plans to tackle this. Thank you.
So Councillor McCall, if that's correct, then we'll obviously ensure that's taken account of as part of the new action plan, yes. And I think PB Paul Smith might come and add to that.
The only thing I'd add to that, Greg, is that the task force subgroups that were mentioned earlier, one will be on employability, and it will tease at some of these issues further and take actions on them, and we'll support that fully.
Thank you. I see no further questions, and in that case, I'll ask Councillor Lane to move the report, please. Thank you.
Thanks, Deputy Provost, and I'll speak to the mic and not behind me this time. Suitably chastised. So today, I'm going to summarise the local child poverty action report for 23-24. It's a vital document that reflects our ongoing commitment to addressing child poverty in Perth and Kinross. This report marks our 6th edition, and it outlines the actions taken over the past year, the progress made, and our strategic plans for the future. The Child Poverty Scotland Act 2017 mandates that we publish this report annually, ensuring transparency and accountability in our efforts. Currently, approximately 5,750 children, or 21.7% of our young people, are living in relative poverty. While this represents a slight and welcome decrease from last year, the stability of these figures, both locally and nationally, since 2017, highlights the ongoing challenges we face. Therefore, our strategic aims remain clear. We have to raise awareness about the causes and consequences of child poverty. We must foster social cohesion and reduce stigma surrounding poverty, and also reduce the negative effects of living in poverty for children and families. And we must also enable families to prepare for a life free from poverty. We are committed to a whole family, whole community approach, ensuring that every child and family has access to the support they need. We have both achievements and areas for improvement. This report showcases several successes. The percentage of employees earning below the real living wage has decreased significantly from 16.5% to 10.4%. Our employment rate has returned to pre-pandemic levels, and we have successfully processed over £3.2 million in Best Start grants. We have provided emergency cash assistance to 4,135 households, demonstrating our commitment to immediate support. However, we recognise that there is still work to be done. The gender pay gap has risen to 15.6%, and we must continue to address the barriers that prevent families from achieving sustainable livelihoods. This report highlights innovative initiatives such as the Supporting People Addressing Need programme, which has secured £1.3 million of funding for interconnected projects. The Infant Food Insecurity Pathway, aimed at ensuring that families with infants have access to essential nutrition. The Future for Families initiative, funded up to the tune of £335,000 by PKC and Scottish Government to the tune of £305,000, which provides holistic support to parents in priority groups. These programmes exemplify our commitment to not only alleviating poverty, but also empowering families to thrive. As we move forward, our Child Poverty Action Plan for 2024-25 will focus on 3 key areas. Work, providing opportunities and support for sustainable employment. For dignified living, we've got to maximise the support for families to meet their basic needs. And survive and thrive, ensuring that the next generation has the resources to succeed. We will continue to collaborate with our partners, including NHS Tayside and community organisations, to monitor our progress and adapt our strategy as needed. In conclusion, while we have made strides in tackling child poverty, the journey is far from over. Together, we must reaffirm our commitment to creating a brighter future for all the children in Perth and Kinross. And let's continue to work to ensure that every child has the opportunity to grow up safe, respected and confident in their potential. Thank you, and I move the report.
Thank you, Deputy Provost. Notwithstanding my emphasis on older people in my comments in support of the previous paper, it goes without saying that tackling child poverty is the very highest priority, or should be the very highest priority of government at all levels. There are some sobering stats in this paper, ladies and gentlemen. Here's just a few. Despite modest progress in Perth and Kinross, we still have, as the leader has said, 21.7% of children living in relative poverty. We also have 43% of parents with children in early years education, sometimes or always having difficulty making ends meet. Someone went hungry in 9% of households with children in early years education in the last year because there was not enough money for food. And 25% of parents with children in early years education struggle to heat their homes. This is despite the concerted efforts of community partners, the Council Welfare Rights Team, etc., and numerous agencies to support families in so many different ways, for which they are all to be sincerely congratulated. Provost, or Deputy Provost, I also have to mention a word spoken several times today by elected members, that is stigma. Reference is made in the recommendations of the report of the need to reduce stigma surrounding poverty for children and families. Stigma is defined as a mark of disgrace associated with a particular circumstance, quality, or person. But I am sure that all 40 elected members will agree there is absolutely no stigma associated with the circumstance of child poverty, and that concentrated efforts must continue to try to reduce this. Provost, I am fully supportive of the strategic aims of the report and of the joint objectives of this Council, NHS Tayside, and our other community planning partners. Thank you.
Thank you. And we now move to comment, and Councillor Duff, John.
Thank you, Deputy Provost. I'd just like to start by thanking officers for the report, which sadly is the sixth such annual report on child poverty that we've seen. A lot has been said today about poverty issues, which I don't intend to revisit. Suffice it to say that as a council, we need to redouble our efforts to lift our people out of poverty. I believe that the best way to do this is to improve the local economy, support the business community, bring in better paid jobs, and to work harder to bring the gender pay gap down to zero. Thank you.
Thank you. Are there any more comments? I see none. Last chance? No. Council, can we agree with this report? Thank you. We now move to item 8, the Perth and Kinross Annual Performance Report 23-24. And can I again ask Greg Boland to introduce this report? Thank you.
Good afternoon again, councillors. I'm pleased to present the Perth and Kinross Council Annual Performance Report for 2023-24. This report is a key component of the strategic planning and performance framework, supporting the delivery of our council's vision and achievement of our outcomes. This report provides an overview of our performance against our priorities, actions and KPIs outlined in the corporate plan. The annual performance report is structured into several sections aligned to our key priorities and is supported by a range of appendices. The appendices are Executive Summary, which provides a quick overview of key performance measures and trends for each priority, and an update on the Corporate Development Improvement Plan for 24-25. There are also links within the report to case studies, financial information, and an additional report on how we are performing against the best value themes which are set nationally. Throughout the report, there are examples of how our services have been positively impacted individuals, businesses and communities. However, we do recognise that the challenges we faced in 2023-24 and those that will lie ahead. I would highlight this as a transitional year for several reasons. The Council has undertaken phase 1 of the leadership review, and operating models are currently being implemented across the Council. Alongside this, we are reviewing our strategic planning and performance management framework. As we review our strategic planning and performance framework, we will review the Corporate Development Improvement Plan approach and how this is in line with the corporate plan and how we report on the annual performance. We are proposing that this is developed into a 3-year rolling programme, as often long-term improvements are not seen or realistically achievable within a 12-month period. Council is asked to approve the annual performance report for 2023-24. We have officers from across the Council to answer any questions. Thank you, Deputy Provost.
Thank you. Do we have any questions? I see no questions. Last chance. In that case, can I ask Councillor Lang again to move the report? Thank you.
Thanks, Deputy Provost. I didn't expect to begin up again so promptly, but so Provost, Baileys and fellow councillors, I'm pleased to move the Council's annual performance report for 23 to 24, setting out the work which has been undertaken by officers with and on behalf of councillors, partners and local residents over the past year. In December 2022, there was unanimous backing for the corporate plan and agreement on the 7 priorities that we should focus on to deliver our ambitious vision for a Perth and Kinross where everyone can live well, free from poverty and inequalities. This is the second report on performance against the corporate plan from 22 to 27, and it gives the opportunity to look in the round at the activity which has been taking place across the organisation to deliver on the priorities we agreed as Council. The scale of the challenge we set for ourselves and for officers should not be underestimated. But when the latest estimates show that almost 6,000 children across Perth and Kinross are impacted by the realities of poverty and that issues such as inflation and associated economic challenges serve to worsen inequalities, we simply cannot lower our sights. Once again, over the past year, council teams have continued to work together with our community planning partners and others to deliver essential services with and within our communities. Much of that work takes place behind the scenes, activity that our residents do not witness, but which they soon notice if it didn't happen. The size and scope of the work undertaken by our services across Perth and Kinross is significant, and neither this report nor I can hope to do justice to all. But I would like to take the opportunity to highlight a few specific areas as an indication of some of the achievements of this past year. Tackling poverty. By supporting parents into work and removing barriers to employment and closing the poverty-related attainment gap by addressing literacy, numeracy and health and wellbeing through the support of the public PEF funding, we also generated £8.5 million in additional income from Perth and Kinross residents through the benefit system, a 31% increase on the last financial year. We continue to tackle climate change and supporting sustainable places, and the Council's environmental action was recognised with an A rating from the Carbon Disclosure Project in 2023, a significant improvement from a D grade in 2019. Developing a resilient, stronger and greener economy by investing £50 million in cultural infrastructure over the past decade, including the new Perth Museum, which opened in March 2024 and was awarded a 5-star status from Visit Scotland. 901 adult learners were also supported by PKC and the Adult Learning Partnership to gain qualifications and improve essential skills, enabling them to overcome barriers. Focusing on enabling all of our children and young people to achieve their full potential by reducing the poverty-related attainment gap for school leavers. The effective use of the Scottish Attainment Challenge funding has helped reduce this gap, particularly in senior phase attainment. Educational attainment across all sectors in Perth and Kinross shows a steady upward trend with notable improvements in literacy and numeracy. Our early discharge project supported 213 people, helping 92 regain full independence and 56 to return home swiftly despite limited heart or care at home services, which demonstrates our commitment to protecting and caring for our most vulnerable groups. Working with third sector partners, we promoted and developed peer-to-peer support networks and worked with partners to set up carer cafes in Crieff, Aberfeldy and Blairgowrie to support and promote physical and mental well-being. We also invested over £1.1 million in walking and cycling infrastructure, opened a new outdoor early learning childcare project alongside improving parks and play areas. While working in partnership with communities underpins the work officers are doing across all of our priorities, in the past year, 104 groups received community investment funding and 258 groups were supported to enhance their capacity for community projects. Significant projects included a £300,000 all abilities play area in Auchterarder and new changing facilities for Blairgowrie and Rattray Community Football Club. And in 2023, 173 new affordable houses were completed, with a higher proportion in rural areas of 64%. Finally, I would like to take this opportunity to extend my thanks to all officers, staff and yourselves across the council for being able to give such a positive report. And the last caveat to all that good news is, although we're doing all this and doing it well, we can't lose sight of that. Although we're achieving most of what we try and do, there is plenty more avenues that we need to explore to fully serve the people of Perth and Kinross. Thank you.
Thank you. Councillor Eric Drysdale to second the report. Thank you.
Thank you again, Deputy Provost. Deputy Provost, this is a balanced report on the performance of this council for the first full year of this administration. It highlights that the majority of key performance indicators are trending in a favourable direction. That's good. But there are also other KPIs where there is clearly more work to be done, including in terms of doing what PKC can to regenerate our city and towns within its powers and financial capability. In this regard, any inward investment is welcome, and so it is with significant disappointment that I can confirm to Council that we have been notified in the last hour that the 5 million levelling up money previously earmarked to fund important projects to help regenerate Perth City Centre has today been withdrawn by the UK Government. Nevertheless, colleagues, I am happy to second this report and welcome the detailed scrutiny of it by the Scrutiny and Performance Committee. Thank you.
Thank you, Councillor Drysdale. Are there any comments? I see none. In that case, sorry, Councillor Duff.
Sorry, Deputy Provost, I just wanted to nip in and make a comment regarding the last Councillor Drysdale's statements. I think it's extremely, I appreciate this and about the report specifically, but I think it's extremely disappointing to hear that the £5 million, which was so hard won by Perth and Kinross for Perth City, has been withdrawn. I hope that in whatever is replaced, or whatever that comes in the replace of the previous levelling up funds, that Perth will be given a priority in terms of a share of any further funding. Just on the report, thanks to the officers for the report. I obviously appreciate the work that went into that. It's good to see that things are generally speaking going in the correct direction, but as has been said, there are a lot more things that we need to do to try and improve on our overall performance. Thank you.
Thank you. Bailey.
Since we seem to be talking about the levelling up money withdrawal, thought I'd say my piece now. Been crunching the numbers on this. Obviously, it's bitterly disappointing to lose that 5 million of capital money specifically for the City of Perth. But in the grander round of things, I've been crunching the numbers, and there's 3.4 billion of additional Barnet consequentials coming to the Scottish Government. If those were to be distributed and distributed evenly per capita across Scotland, that would give our local authority area something like £100 million. So as Councillor Duff says, let's wait and see what else is coming, because for me, it's a good day at the office if you perhaps lose 5 million but gain 100 million at the same stroke. But let's wait and see what the Scottish Government does with those Barnet consequentials. Thank you.
Thank you. Councillor Ling. Grant.
Yeah, have to comment on the news about the withdrawal of the Levelling Up Fund, which means that Perth has ended up with nothing from the Levelling Up Fund over the years that it's been running. I hope Bailey is correct, and we do see it moving forward. I feel sorry for the officers who've spent time working on these projects, time that's now wasted unless we can find the funding from somewhere else or it comes in. That's just been an abortive spend. So we will just have to wait and see what comes out of it. And the most unfortunate thing is this will be the headline in the press, and all this good work that we are doing about poverty, which should have been front and centre of the press attention tomorrow, it will be the fact that Perth has received absolutely no money through the Levelling Up Fund. And that's extremely disappointing for us all, I think.
Thank you very much. There being no further comments, Council, can we agree this report? Thank you very much, and I'll now hand back to the Provost. Provost.
Thank you, Deputy Provost. Members, we move on to item 9, Integration Joint Board Annual Performance Report 2023-24. And Jackie Pepper, Director, Chief Officer of Perth and Kinross Health and Social Care Partnership, is going to introduce the report. We'll just let officers do musical chairs over here. I'll give Jackie a second to settle in. Whenever you're ready, Jackie.
Thank you very much, Provost. Thank you for the opportunity to bring this annual report to Council for the first time. And it comes forward as part of our planned improvement to ensure that there's greater connectedness of the Council and the work of the IJB and our delivery via the Health and Social Care Partnership and with partners across third and independent sectors. So this report details performance in relation to the nationally determined core suite of integration indicators, supplemented by our local quantitative and qualitative data. And that together serves to tell the story of the impact and experience of people who use our local health and care services across Perth and Kinross. So members will note that the IJB has agreed a revised joint strategic needs assessment and strategic plan in June of this year, which is post the period that this report relates to. And that provides us with further opportunity to focus our improvement in key areas and to devise a new performance management framework within the current year. The report was considered by the Council Scrutiny and Performance Committee on the 18th of September, and noting the conclusion that overall performance is positive in relation to the nationally determined indicators, with 22 rated green, 3 amber and 5 red. Throughout this annual performance report, members will see examples of how we as a health and social care partnership are focusing activity at earlier opportunities for intervention and prevention, and for further integrating our services to deliver a more seamless experience for people who use them. And the recent completion of our integrated senior leadership structure will further enhance integration across the health and social care partnership. Happy to take questions along with Mr. Chris Jolly, who's here as Service Manager for Business Planning and Performance for the Health and Social Care Partnership. Thank you, Provost.
First question, Councillor Allen.
Thank you, Provost, and thank you for the report. It's my understanding that Audit Scotland have described IGB finances as unsustainable. What plans do we have to deal with that issue?
Thank you very much, Councillor Allen. The most recent meeting of the Integration Joint Board on the 2nd of October considered our financial position within the current year 24-25 and approved a financial recovery plan. That financial recovery plan sets out actions that we will take within the Health and Social Care Partnership to reduce expenditure by £1.3 million and apply the use of IJB reserves to meet that in year.
So that's currently underway, and in addition to that, we'll be reporting to every IGB on the position in relation to that recovery plan throughout the year.
Thank you. Bailey Williamson.
Thank you, Provost. My question is around about palliative care. Throughout the report, Jackie, you mentioned repeatedly about the aging population and the Alzheimer's, and with people who are going to unfortunately get Alzheimer's in later life is also going to increase. And I'm just wondering, given we know that we have this aging population coming around the corner, what measures are being taken now to prepare for palliative care of people and going forward?
Thank you very much, Councillor Williamson. In terms of palliative care, that can be provided in a number of different settings, and it's important that we recognise that that's appropriate, and it's very much a choice for individuals as well. So you'll see throughout this report we talk about our local nursing services and the integration of those with social care. So that will allow people to receive end-of-life care at home if that is their choice. And we also provide significant support for people at end of life within our community hospitals, of which we have 4 in Perth and Kinross. The important role they play in that is not to be underestimated. We don't necessarily report on numbers in that, but that's something that we can think about in future reports and draw attention to how we're doing that. It's very much about ensuring that we have the skilled staff and a multidisciplinary staff team around that. So our integrated teams at locality level are going to be key to that.
Thank you.
Jackie, I was just wondering, do we have information on where the majority of people end their life? I mean, is that in a care home setting, hospital, or at home, or another setting? I mean, I understand nationally the figures are that the majority of people tend to die in a hospital setting, unfortunately, but yeah.
Yes, thanks for the question. Page 251 of the papers today presents the national data, so national indicator data, and indicator 15 tells us about the proportion of the last 6 months of life spent at home or in a community setting. So in Perth and Kinross, that's around 89%. So about 89% of that time is spent at home, and that reflects people's choice and also the variability in their condition, where they may spend some of that time in hospital and then some of that time back at home again. But the headline figure is that 89% of the time spent at home.
Thank you. Bailey Ham.
There we go. Thank you. You just said in that last answer there that you don't give numbers, but I'm looking at the comments on page 265 of the Community Mental Health and Wellbeing. And there's 2 paragraphs there giving the rate of which is for mental health is depression, the rate of which is 11.9% lower than Scotland and overall. And then the next paragraph goes on about Alzheimer's disease and dementia, which is 23.4% lower in Scotland, and self-harm, second cause, of 29.4 higher than the rest of Scotland. That's actually meaningless without knowing any figures. We don't actually get from that just how bad and what the number of cases are and the prevalence is within Perth and Kinross.
Oh, I think that's us now. Yeah, thanks very much. I think we will have data that sits behind us, Councillor Hearn or Bailey Hearn, and but I think what this is serving to do is to highlight the incidents and compare that to Scotland. So so although we are reporting here that we have an early cause of death as related to Alzheimer's and dementia for example, it is lower than Scotland, although it's a high feature for our population in Perth and Kinross. So it is significant in that sense, but I can provide you the data if you would like to see that.
Thank you. Councillor Robertson.
Thank you, Provost. Can I ask a question about in page 13 of the actual report about the vaccination service? It says that from July this year, all vaccination services for children and adults will be operated from Poor House, which is good. But I've actually been contacted by constituents who've got serious mobility issues, and they find it almost impossible to get from the nearest car park to Poor House. I spoke to the local GPs about it, and they say, as a report says, they have no input into what happens. So how can it get to a system where we know that if people have got serious mobility issues, that can be taken into account when vaccination appointments are allocated?
I can advise you that the vaccination and immunisation services is managed by public health or population health division within the NHST side, but we know that we are delivering vaccinations to people in their own homes should they require it. So that's something that's done as a matter of routine. So if you do have constituents that have severe mobility issues and would benefit from that, they should access that through their local GP, and a home visit will be carried out. Poor House is an accessible building with an accessible car park, so I can only imagine that they have individual particular requirements. So a home visit sounds like the best option.
And sorry, they organise it through their GP, did you say? Thank you.
Thank you. Councillor Peter Barrett.
Thanks. Thanks, Provost. Firstly, I want to commend the significant improvement in delayed discharge bed days and the performance there, with a reduction in bed days lost of over 500 or 26.3%, which is, I think, an excellent result. So well done to everyone involved in that. My question is regard to National Indicator 14 on the same page regarding the number of emergency readmissions to hospital within 28 days of discharge, where their performance has slipped and is considerably worse than performance nationally. And I just wondered, is there, I know on the following page there's reference to the frail elderly, but there isn't really any sort of breakdown or identification of trend as to why that's happening. I wondered if any of that analysis has been done, and what improvement actions are being organised to address that.
Thank you very much, Councillor Barrett. This is a complex arrangement here in relation to the indicators and how they relate to each other. But I can reassure you that the IJB's Audit and Performance Committee have been asking those very questions. And it is an area where we know, I think we're on a par with Tayside in terms of the performance here. And we do know that you're more likely to be readmitted to hospital within 28 days of discharge if you're over the age of 65 or over the age of 85. So it is age related. We had attendance at one of the performance audit and performance committees, the medical consultant who was indicating that these numbers are looked at in detail through the clinicians to examine that, and there's an arrangement where they have a peer review, and that's to look at the medical situations. So if you're thinking about this being older people and the readmission rate being higher, it's not necessarily that they're being readmitted with the same condition, and that's one of the findings. However, we want to do some work locally and look at that in a bit more detail, but not just look at the clinical reasons for admissions, but look at the social circumstances as well and pull that together. So the numbers are relatively small and will allow us to do that deep dive, but it's certainly something that is on our radar and we're looking at very closely because I think we can learn a lot from it. So thank you for that.
Thank you. Councillor Smith.
Thank you very much. My question is on page 253, feedback from people that use our services. I just need to get some more information regarding point number 6, the indicator. Percentage of people with positive experience of the care provided by their GP practice. Could you let me know, please, if that, for instance, includes the availability of appointments at their practice? Now, I know that there's a lot of them under stress, etc., but they're varying so much at the moment, people not being able to get appointments. Is that included in this survey? Thank you.
Hi, thanks for the question. So the indicators in that table are all derived from the National Health and Care Experience Survey, and the questions relate directly to each one of the indicators. And the question, I don't think, gives the level of specificity that the councillor has asked for, and is more of a generic question in the sense that in relation to the overall experience that people have had. I'm not sure I can give more detail than that, but I can direct the councillor to the national published data sets where there is an opportunity to look in more detail at a broader set. The 9 national indicators here are very much a subset of the larger questionnaire.
Thank you.
Thank you. Bailey Ahern. Sorry, just before you come.
And just to provide some supplementary information about, we have a lead GP within the Health and Social Care Partnership who has a role in supporting quality improvement and directly with GP practices. So GPs practices we know are using this data in terms of their own improvements. So and just to say that that's something that's carried out in a regular way in terms of that continuous improvement activity.
Thank you. Bailey Ahern.
That's better. Something wrong with this one. This next question is on the same page as it was before, community mental health and wellbeing, and it's the 4th paragraph on consultant psychiatry assessment and ADHD assessment. ADHD assessment is currently 2 years for a child. Not quite sure of the waiting list for adults, but we've been lost track of how many times we've sat in this chamber and talked about the lack of consultant psychiatry over the years. And I know it's a national problem, but it's not right to keep coming back. What is being done to try and solve the problem? Tayside for a couple of years relied on locum consultants coming in, which was costing a fortune for the NHS. We can't rely on that. So what is the NHS doing to get substantive consultants in place to try and alleviate this problem?
Thank you, Bailey Ahern. As you say, this has been a long-standing problem nationally and probably UK-wide as well, with a strong reliance across Tayside on locum consultant psychiatrists. The most recent update that we've had through Dr. Peter Lefevre, who's the Operational Medical Director for Mental Health and Learning Disability Services, was that was an improving picture. And in fact, he was reporting recruitment to a permanent psychiatrist to Perth and Kinross under community mental health teams. So that was a positive update that we had, but also the other initiatives as described in this report are about supporting the training and development of advanced nurse practitioners who can deal with a whole range of presenting issues in relation to mental health in the support of psychiatrists in order to alleviate that. And that's something that I think will absolutely be essential in terms of ongoing sustainability. And as you know, that there's a drastic shortage of psychiatrists, and the training to qualify as a psychiatrist is 9 years. So we have to find other ways of managing that. So I think it's detailed in here about the support for and expansion of advanced nurse practitioners in this area across the board, and that's both across community provision but into inpatients as well.
Thank you, and I welcome that for the advanced nurse practitioners, because that will help to alleviate the problem.
Okay, thank you very much. I'm seeing no further questions, so
I have two more questions in the queue.
Oh, sorry, I thought you'd finish. I thought that's why I came back to you for your next question there, Bailey Hearn.
The next question is on page 268, which is neurodevelopmental pathways, and there that you're going to be designing new pathways and treatment service. I produced a paper a couple of years ago with regards to neurodevelopmental pathways, especially in children. And I know that the IJB is responsible for adult mental health and not child mental health. However, it's possibly short-sighted to be doing a pathway for adults without incorporating a pathway for children's services, because it's well known that if you want to get anywhere with neurodevelopmental disorders in children, you need to start early, preferably before the age of 8, because you then stand a chance of being able to help develop those different neurodevelopmental pathways within the brain of a child that's under the age of 8. And so is that service going to be expanded to include children as well?
I'm not certain if that is the action that will be taken forward, but what I can give you reassurance on, Bailey Ahern, is that the whole system change programme is continuing to focus on the neurodevelopmental pathways, and is also focusing on transitions. So there's joint working between the child and adolescent mental health services and our adult services, and that work continues. So it's very much a priority for us across the whole of Tayside, because what we need to have is a consistent model for the whole Tayside population.
Thank you. And I promise this is my last question, and it's on page 296 with regards to health and well-being within the prison sector. In the inspections. So the inspections were carried out up to 26th of May 2023. And as it was mentioned earlier, 9 were rated as generally acceptable, 2 were rated as poor. We're now a year down the line. Have any of those been sorted out? And if not, when would they likely be to be sorted out?
Bailey Ahern, could you refer me to the actual page in the document rather than the no, on the, I don't have the document pack, sorry, it's the actual document. 52. So it's the inspection of the prison inspections. Yeah. There is associated with all inspections across the prison estate. You'll know that it's a joint inspection that's carried out by His Majesty's Inspectorate of Prisons and Healthcare Improvement Scotland, and there is an action plan associated with every inspection. And I couldn't tell you the position in relation to this particular action plan, but there will have been movement and we will be tracking that. But if you're looking for detail around that, I'm happy to provide it.
Yes, please. Thank you.
Thank you. I'll come to Councillor Colin Stewart to move the report.
Thank you, Provost. And before I do move the report, I wonder if I might just add a little to the Chief Officer's response to Councillor Allen's first question regarding the Audit Scotland position on IJB finances and sustainability. The network of IJB chairs and vice chairs yesterday had a briefing session from Audit Scotland specifically on their report. And we're meeting with the Cabinet Secretary for health and social care next week as a group. The issue, I think, in terms of the position on IJB finances is right across Scotland, but one of the difficulties that the financial position puts all of the IJBs in is that we have very little flexibility, so there's no capacity to plan for the long term and to do the early intervention and prevention and public health work that we would be really keen to get our teeth into and get to grips with. But as I say, we will raise that next week with the Cabinet Secretary. Provost, this annual performance report approved by the Perth and Kinross Integration Joint Board sets out performance in relation to the national core suite of integration indicators and provides an overview of progress in meeting the Integration Joint Board's strategic plan. It also sets out the experience of people who use health and care services and their carers. This council and the Health and Social Care Partnership take their responsibility to make sure that these essential services are delivered to high professional standards, and over the last few years have strengthened the reporting of both performance and the quality of the social care services delivered at the direction of the Integration Joint Board. This is the first time Council has received this report, and it is a welcome opportunity for all elected members to consider the extent to which these services are making a difference for the people of Perth and Kinross, as it's essential that we keep health and social care high on our agenda. This report shows that there has been demonstrable progress in key areas, enabling people to spend more time at home as independently as possible and less time in hospital when they can be supported to return home or to a homely care setting. The report also highlights key areas for improvement which are directly related to the challenges of our ageing population and the associated issues of frailty. And the report highlights that there's a need to focus on preventing hospital admissions. Focused improvement activity in these areas is already identified in the Health and Social Care Partnership's transformation programme and strategic delivery plans, and the recently appointed senior team in the Health and Social Care Partnership will bring about greater integration for our communities. I'd like to thank all health and social care staff across the Council and the wider partnership, as well as those working in the independent sector, for the work they do daily and at evenings and overnight, and for their dedication and for choosing to make caring in Perth and Kinross their vocation. Provost, members, it gives me great pleasure to move the report.
Thank you very much, Councillor Stewart. Councillor McCall to second, please.
Thank you, Provost. This performance report sets out the experience of people who use health and social care services and of their families and carers. Supporting people to live longer and healthier is an important part of the work of the Integrated Joint Board. Generally, our population is living longer, which is good, but this also brings with it more complexity and increasing demand for our services, with the attendant cost pressures exacerbated by the cost of living situation and market price increases, particularly in pharmacy. One aspect the report highlights is the age demographic in Perth and Kinross, which I'm sure we're all familiar with. We have one of the largest percentage of residents over the age of 65 of any local authority in Scotland, and indeed we have the largest percentage of over 85s in any mainland council. Yet, we have an above average life expectancy compared to the rest of Scotland, in an age where poverty and other social and public health factors are contributing to a reduction in life expectancy, and that we in Perth and Kinross are above the national average is to be commended. And as a resident in that older generation demographic myself, I am personally very pleased with that particular performance measure. I may not be alone in the chamber in that view. Council, this positive outcome, plus the other positives in this IGB performance report, is a testament to the work and dedication of our excellent health and social care staff, both frontline and back office, working in partnership with Perth and Kinross Council, NHS Tayside Board and third sector partners. A whole system approach delivers consistency and improved outcomes both locally and across Tayside. And it's very welcome to see that taking place, and I look forward to more of that going forward, particularly working with the council here. While performance measures reported here today are to be welcomed, there is always room for improvement. There are challenges in staff recruitment and retention, access to mental health services, and reducing deaths by suicide, a few of the areas where we want to improve. So the transformation work currently being undertaken seeks to explore and implement improved ways to deliver services, as well as identifying preventative measures to reduce risk and improve overall health and well-being for all our residents across all age groups. As with business as usual, the transformation programme will be developed and delivered with contributions from all of the IGB partners, including alignment with the relevant service areas and Perth and Kinross Council as appropriate. Colleagues, finally, we cannot underestimate the contribution of those with lived experience. On the IGB, I'm very lucky to have a number of carers and service users who provide invaluable information and inform the way that we develop our services and how we deliver them, both current service delivery and crucially going forward. And so I wish to extend my thanks and appreciation to all of those who participate in the full IGB process. Provost, I am very pleased to second this Integrated Joint Board Annual Performance Report for 23-24. Thank you.
Thank you very much, Councillor McCall. Councillor Robertson.
Thank you, Provost. The problem with having access to your computer when sitting here is you can actually ask questions about things that you've raised. And I actually responded to a GP in Kinross. I said that I was pleased that people seeking a vaccination at home can actually just do it through their GP. His response was, that is complete nonsense, which I'm very, very sad to hear. He says, I explained to you earlier that the vaccination process was centralised, and as a result, we have no access to vaccines or their application is completely closed and controlled by the vaccination service. There's been no discussion with GPs regarding this scenario. So can I possibly indulge you and ask Jackie to clarify what she said? Thank you.
Put that down as a point of clarification, Jackie. Would you like to provide some clarity?
Oh, sorry.
As a point of clarification, it wouldn't be the GP that would be providing the vaccination, but I think in terms of making that inquiry, but why don't you give me the information and I'll sort it out for you, Councillor Robertson. Thanks.
That's very kind, thank you.
Thank you.
See, that's instant service. Where do you get that nowadays?
So efficient. Computers will replace us all soon, will I? If there are no further, comments, we shall allow Councillor Stewart to sum up if he wishes. Okay, thank you very much. Can we agree the report? Great, thank you. Members will take a brief comfort break and resume at past. Good afternoon again, members. We now move on to item 10, the Armed Forces Covenant Progress Report. And Elaine Ritchie, the Strategic Lead for Housing and Communities, is going to introduce the report.
Thank you, Provost. This report clearly sets out a range of actions and activities which have been undertaken to evidence our continued progress in relation to the Council fulfilling its commitment under the Armed Forces Covenant. Our commitment covers 3 areas: the services we provide to members or former members of the Armed Forces and their families living locally, our responsibilities as an employer to veterans, reservists, adult cadet force volunteers and those that fall under the Employer Recognition Scheme, of which we are proud to have achieved the Gold Award in 2021, and our civic responsibilities. We have a long-standing commitment to this area of work, having signed the first covenant in 2012, and the report outlines the infrastructure which is now in place, supported by officers across all council services, liaising closely with Baillie Ahern in the council's Armed Forces Veterans Champion. I would remind members that since November 2022, this has been a statutory duty applying to the Council's housing and education functions and certain health functions delegated to the Integrated Joint Board. We continue to have an action plan in place to monitor this work and ensure our commitments under the duty are evidenced, along with an agreed budget to support this work. In particular, I would draw your attention to the fact that we now have some context in terms of the demographics for this area of work, with figures now available from the 2022 Scottish Census, which for the first time asked people to identify who had served in the armed forces. This responses indicate, for example, that we have just over 6,900 people in Perth and Kinross who have served in either the reserves or the regular forces, over 6,000 males and over 856 females. We have the 9th highest number of those having served in the armed forces among the 32 local authorities in Scotland. We will continue to prioritise this work within the Council, and Section 5 in the report outlines the detail of the work undertaken directly by the Council and in partnership with the veteran support organisations. Thank you. Happy to take any questions, and apologies for a slight typo in Section 4.2 of the report.
Thank you. Don't think Councillor Forbes put it in the right chat, but I saw a cue come up from you, so you can ask your question.
Thanks, Provost. Getting to the day where I'm losing sight of what chat's what. Just clarification, Elaine, something jumped out at me that feels as though it's not right, and it's the number of previously served regular armed forces, 80 and over. That 1,440 seems a very, very large number compared to the others. I'm just wondering if it's accurate.
The appendix, which quotes these figures, is a straight lift from the census, so that was what was available. Yeah, and it tallies up with the overall figure. If you, so it must be, assuming it's accurate.
I didn't add it up, but I'll take your word for that. Thanks.
Okay, thank you. I don't see any other questions, and that being the case, I'll come to Baillie Ahern to move the report.
Provost, Councillor Lane, thank you for allowing me to move this report. It's fitting that we're discussing this report this week, just 1 week before the country remembers those that fought for our country, gave the ultimate sacrifice. Many of you will be laying wreaths at war memorials in a tribute that's taken place since World War I, when the nation remembers our forces past and present. This report details what this council does to support veterans, and very importantly, and often forgotten, the families of the armed forces community, including the bereaved. It also includes the cadet forces, some of which will be our future soldiers, sailors and airmen. It details our support for the Armed Forces Covenant, and paragraph 4 of the report explains what the Covenant is and how we apply the principles of that Covenant into all our services. We have officers, as you've already heard, in all services of the Council who are aware of how the services meet out the needs of our veterans and the forces families and use that knowledge where needed. Paragraph 4.4 explains that we've achieved the Employers' Gold recognition in 2021, and this was awarded to recognise this council's commitment to its staff, who are reservists and adult cadet force volunteers. The award is verified every 5 years, and even though our verification isn't until 2026, we've already started the process, with the criteria becoming even stricter and changing every year. This can be seen by the number of organisations that are currently losing their Gold Award this year, something I will strive to ensure does not happen to Perth and Kinross Council. As a Gold Award organisation, I sit on the Gold Award Network, which comprises of organisations in our region who have achieved the Gold Award and are willing to work together and support bronze, silver and bronze holders to achieve gold and learn from each other, which can only benefit our veterans and reservists in the workplace. Paragraph 4.12 mentions the 2022 census, and at long last, and for the first time, we can get a picture of how many people have served and are living in Perth and Kinross. And this shows that just over 5% of our population are serving or have served in one way or another, and as is being pointed out, is the 9th highest as a local authority in Scotland. And in line with the general population statistics, an ageing population, and it is worth noting that this is over 50% of over 65s in veterans. So you and I have a long way to go to reach out to our veterans in our community. Finally, I would like to thank the Provost, Deputy Provost, the leader and everyone else in the Council for the work you do for our armed forces community. And once again, I'm pleased to move this report to the Council, reporting our commitments to the armed forces family and the great work that is done by everyone. Thank you.
Thank you, Baillie Ahern. Deputy Provost.
Thank you for this opportunity to second this report. And can I say first that I'm extremely grateful that Perth and Kinross Council is one that chooses to fully and willingly give support to the Armed Forces Covenant. For me, as you can imagine, it's an important issue. I'd like to draw attention to the point at 4.1, which mentions families. And certainly in my lived experience, family members have suffered, I think, unconscious discrimination because of the profession that I followed. So the mention of families there is very important. And the third point I want to make is that the shape of our veterans population is changing. You now have to be over 60 to have taken part in the Falklands conflict. You're over 50 if you took part in the first Gulf conflict in the early 1990s, and most of those who served in Iraq and Afghanistan are now in their late 30s and early 40s. And with regard perhaps to that latter group, there are a small number of them, a very small number, but an important number, who have survived life-changing injuries in those conflicts that they would never previously have survived. And they are people who genuinely need as much support as they can be given, and I hope that we will always be in a position to give that. And if I may, I think I can answer Councillor Forbes's question on the over 80s. That is the last cohort of individuals who were caught up in national service when service was compulsory. Thank you.
Thank you very much, Deputy Provost. Comments from Bailey McLaren first.
Thank you, Provost. Thank you, Elaine and David, for the report. Bailey Ahern, Deputy Provost. Being a mother of a serving person in the military, it's sobering to read this. And prior to becoming a councillor, I had no idea of this and the detail and the support, but undoubtedly there are many communities that we have within our area region of Perth and Kinross, but this is a really important community, and each village and town that we drive through, we're reminded of that by these memorials of those that have served, and it's our social responsibility to be mindful of their service, their commitment, their family service that sits around it as well. And I just commend our officers. And yet again, Perth and Kinross is glowing and sits, is sitting high up in other local authorities and what we're achieving here. So I just have to say a thank you. So and for all those that do the work, thank you very much.
Thank you, Bailey McLaren. Next, Councillor Braun.
Thanks, Provost. I'd just like to take the opportunity to thank all the officers involved in maintaining the Covenant and the Prior's Gold Award. We should also recognise your involvement, Provost, and thank you for continuing to give your support with civic and military events. And I'd like to congratulate my colleague Bailey Ahern for all his valuable and essential work in supporting our veterans in all areas. All have worn a uniform to defend this country, and it is our duty now to ensure their welfare. And all our veterans, wherever they are and whoever they are, may I just simply say thank you for your service. Thank you, Provost.
Thank you, Councillor Braun. And Councillor Daw.
Sorry, I didn't quite catch that there. Thank you, Provost. Yes, and delighted to see this report coming forward again, and everything that we do to support and give respect to a very important community, our Armed Forces veterans. And as Bailey Ahern has already said, equally importantly, their families. As a council, I think we can be proud of our support for veterans, and I would like to commend officers, the Provost, the Deputy Provost, and our Forces Champion, Bailey Ahern, for all they do in this area. I note that a list of the events which we attend as a council, which used to be included in the body of the report, is now available on request, and I just wonder if this might be included as an appendix in future. Thank you.
Thank you. And I would just like to pay tribute to Bailey Ahern for his work as Armed Forces Champion, and also Deputy Provost and members across the chamber who do considerable amounts throughout the year. I do get to see a lot of it from my role as civic head, and as has been remarked both in the report but also by members in the chamber, we have a very significant veteran community, and indeed we have members who are members of our communities who continue to serve in both the regular and reserve forces, as has been noted. And it's important that we show our support for them, including those reservists who are members of council staff. So thank you to them for the service they give to our country, and thank you to all of you for the support that you show, and to Baillie Ahern for leading this work on behalf of the council, along with David McPhee and his team. Would you like to sum up at all, Baillie Ahern?
Oh, that's fine. Thank you very much. And thank you for all the comments.
Thank you very much. Members, can we agree the report? Thank you very much, members. Members, we move to item 11, committee timetable, and Scott Hendry, the Democratic Services Manager, is going to summarise the timetable.
Thank you, Provost. Members will see that the proposed timetable for next year largely follows similar practice that we've had in recent years, whereby most meetings take place on a Monday and a Wednesday. There have been some slight adjustments to take account of timings and experience of the last year or so in terms of trying to fit out the best timings for the meetings. The timetable includes information in relation to other groups out with the council, such as Tayside Valuation Joint Board and Tayside Contracts. The meeting dates for the Health and Social Care Integration Joint Board are just being finalised and will be approved by the board shortly, so they will be then included within our overall timetable. Should members wish, we and agree the timetable, it's proposed to possibly bring indicative timetables for next year and up to the 2027 elections that could be brought to the next possible council meeting. Thanks.
Thank you very much, Mr. Hendry. I have a question from Baillie Ahern.
Thank you, and I think a lot of work has been done to try and timetable those committees that overrun. Just picking up on the 11th of June and the 5th of November, where you've got planning in the morning and then you've got a committee in the afternoon. I take it that's completely unavoidable because the one committee we do have that overruns is planning. And I just wondered if there's any opportunity to move that so that we don't have the problems we've had this year. Thank you.
Yeah, in terms of you finalising the dates, as you say, it is difficult to fit everything in. We try as much as possible and avoid clashing with a planning day. But as you say, there's only so many days that we can fit things in. I think what we've done is if in terms of managing the business of the planning agenda, we'll try and take that into account, and also, if necessary, we have delayed start times of the afternoon committees to 2 o'clock. But we will have a look at it again and see if there's anything else that we can do.
Thank you. Baillie McLaren.
Thank you. I just disappointed in that I fully understand Monday, Wednesday, but the but here is that for those that are on planning and licensing, there are committees that are scheduled within recess, and on this timetable I'm looking at, there's 2 planning and 1 LRB within the summer recess, and 2 licensing board and 1 licensing. Can we look at a way of trying to minimise that we have these meetings within the recess period, particularly the summer recess period?
Yeah, I mean, I think we did discuss with the relevant conveners, and I know that both planning and local review body do meet monthly, so it is quite a lot of work for those members. Again, we're happy to have a look at it again and see if there's anything else that we can do. But as I say, it's difficult due to the volume of business. We do feel that the number of meetings that we've scheduled are required.
Okay, thank you very much. Members, can we agree the 2025 committee timetable? Thank you. Members, item 12 is updated governance arrangements. 12.1 is the updates to the scheme of administration. Mr. Hendry, the Democratic Services Manager, is going to give a brief summary of the changes.
Thank you, Provost. I'll just be brief, as it's an agenda note that members have in front of them. The section 28 is to be updated in line when members who are on the Learning and Families Committee will be aware that we made a recent change in terms of engagement with youth members, so that's just for ratification. Sections 37, 38 and 39 is to bring us in line with the recent changes in the senior management structure. Minor change under the strategic lead of legal and governance regarding legal advice, and also a proposed change to the delegation to the strategic lead of environment and infrastructure regarding road traffic orders. Finally, in line with, as you mentioned at the start of the meeting, the completion of the health and social care management team, again, is just to tidy that up and bring that in line with that recent change.
Thank you very much. Members, can we agree the proposed changes as set out in the agenda? Sorry, I do apologise. Councillor Duff, you have a question. Yeah.
Yes, thank you. It's in relation to section 48 and the objections to roads orders. In order to make this consistent with the process for that we have with planning objections, I would like to suggest that included in the 6 objections from the public or one from a statutory consultee, that we add in the opportunity for a community council, or indeed if all of the ward members wish to have it considered by the committee into that section. I'm happy to put as an amendment if need be, but hopefully we can agree that. I think Councillor Stewart wants to come in.
Okay, thank you, Councillor Duff. You did raise this with me just in the recess there, so I appreciate. Thank you for the advance notice and apologies. And I believe you have spoken to some other members across the chamber. It seems like a reasonable position in line with our planning principles. I'm getting nods around the chamber here, so are we happy to make the changes along those lines? Agreed? No? Sorry, Councillor Peter Barrett.
And thanks, Provost. And I'm not sure I fully understood Councillor Duff's proposal, but it does seem to me that when it's come to traffic orders previously, that there's been a majority of ward members in favour of a proposal, then that has been sufficient for it not to go to committee. And it would seem that this would then be given effectively a veto to a single ward member to demand that something goes to committee. Suspect it would possibly extend the decision-making process, which is kind of not what we're meant to be about. So,
sorry, I think my understanding is that it would be all 3 or all 4 ward members as per the planning position that we have mirroring that. But I think it is something that we can maybe agree the changes as they are, and that as long as there is cross-party agreement out with the chamber after this meeting, that can be reflected in the changes as well. Otherwise, we will bring it back for a further discussion, but I think there's probably broad agreement on it. Okay, can we agree the changes subject to that part? Sorry, Bailey Ahern.
Given the disparity and the conversation that's just happened here, if this is going to happen in future, is it worth calling the governance mog just to go over the changes?
I mean, the changes were supposed to be purely technical changes in line with the changes to the management structure of the council. They're not supposed to be a full open heart surgery on the scheme of administration. But if there is wider changes sought by members, then I'm sure that conversation could happen across political groups within the council out with this setting. I'm not going to agree to it on the hoof here. I've already agreed to more than I would be comfortable agreeing to be honest, in that we'll take these out with the meeting and discuss them. So if we can agree the purely technical changes in line with the management structure changes, the now, and any other discussions can happen out with the meeting. Agreed. Thank you very much. Members, item 12.2 is the financial regulations. Scott Walker is desperate to tell you all about them and has been saving this up all week. So, and Stuart Donaldson had warned me earlier that he has lots of questions. So settle in, and that 4 p.m. finish time is rapidly going out the window. Mr. Walker. Oh, sorry, hold on. Just before you got a point of clarification, Councillor Forbes.
I was just going back to what you said a second ago, Provost. If we agree to back to the traffic orders, if we agree to this now, then am I right in saying we can't bring this back in 6 months?
No, we're effectively deferring that part. So and officers can put these onto the agenda out with the 6-month rule, so we're fine. Mr. Walker, it is finally your moment in the sun.
Thank you, Provost. I can just sense the excitement in the room. Good afternoon, councillors. You'll be glad to know I'm keeping my remarks brief. I'd like to start with an apology and a thank you. Firstly, apologies to all elected members for the omission of the section in the introduction on charitable funds that was issued late yesterday afternoon. And secondly, thank you to Councillor Duff for making me aware of the omission. I can assure Council that the final published version will include this update. The financial regulations were last updated in May 2023. Within this update today, there are no material changes. We are simply updating the financial regulations to reflect the most up-to-date organisational structure of the Council, including changes to job titles and the creation of the strategic leadership team. Happy to take any questions.
I have a question from Councillor Forbes.
Thank you, Scott. There's lots of reference in the report to petty cash. I'm just quite surprised in a modern age we're still dealing in cash. I'm wondering what sort of sums are we talking about, and do you think it's still appropriate that we deal in cash?
There is still a demand for cash for some of the service users that we deal with. Some of our social workers, for example, need cash to be taken out. We're talking high thousands of pounds, no more than that, across the council.
Thank you. And indeed, it is worth reflecting there are still people who cannot get bank accounts in this day and age, it's particularly often in poverty. I don't actually have any other questions, but Councillor Donaldson, you did say you had a question. Do you have a question? No, you don't. Oh, wonderful. Oh, round of applause. There we go. Okay. Councillor Donaldson, you wish to move the report.
Okay, elected members may not necessarily consider this to be the highlight of today's proceedings. Nonetheless, it does matter. It's not just about finance officers and Scott Walker, or legal officers and Jeff Fogg crossing T's and dotting I's. It is about updating our regulations to ensure that they are sound, we have good governance, and we're on top of things. And I would also add, it's not just about noting the contents of the report, it's about approving the updated regulations in the appendix. And it does state there are no fundamental changes to the financial regulations. But in actual fact, I view them as being reasonably substantive, because what it does, it reflects the changes in the council structure and the revised reporting lines. And if you look through the report, as I did, I'm sure everyone else did, but it's the word strategic lead in so many places. And I think it's reflective and it's indicative of our transformation programme and of the progress we've made over the last 2 years and possibly have further to go. So I move the report. Thank you.
Thank you, Councillor Donaldson, and I think you get personal best time there for the shortest speech you've ever given in the chamber, 1 minute, 17 seconds. And I'll come to Leader of the Council to second.
Yeah, I'd like to just pay credit. We've always been blessed with good financial teams all the way down and across the local authority, and I'd like they're behind the scenes people that make the whole organisation tick from, and you can see all the roles that they fulfil along with legal and governance. So I'd like if you can pass that to your teams, the regard that we as elected members hold yourselves in. And then I'll say no more, but I'll have a second report.
And there was me hoping you were going to beat Councillor Donaldson's record there. Members, there being no comments on the report, can we agree the report? Thank you very much. Members, item 13 is appointments, committees and outside bodies. Mr Henry is just going to outline what's been sent to members.
Thanks, Provost. So members should have received an updated list of committee memberships, which is for approval. Just to add to that, in terms of the vacancies on the agenda, to clarify further appointments. So proposals are that Bailey McLaren be appointed to Live Active Leisure Board, Councillor Mayer to replace Councillor Massey as the Older People's Champion, Bailey to be appointed to the Friends of Bydgoszcz Management Committee, and Councillor Donaldson be appointed to the Crieff and Strathearn Museum Group. So there are some vacancies that will be rolled on to the next council meeting in December in relation to the Planning and Placemaking Committee, Perth and Kinross Supports Council and the Employees Joint Consultative Committee. So all of that is for members' approval.
Members, can we agree those appointments? Thank you very much, members. Members, we now move on to item 14, which is elected member briefing notes. Can we note the briefing notes issued to elected members since the last council meeting on the 4th of September 2024 as set out on the agenda? Noted. Thank you very much. Members, just before I go on to item 15, I would just like to remind members that there is an event taking place in the Civic Hall immediately after council, and would encourage you to attend that if you are able to do so. However, before we do, item 15 is a valedictory for our own Sheena Devlin, who leaves the council in a few short weeks, in fact. So, Sheena, if you would like to come and join us up here along with councillors Rebek, Duff and Peter Barrett, we might just say a few words. There we go. So we've come to the end of a fairly significant era. Sheena has been with the council for 22 years. Not quite as long as I've been alive, but you know, not far off it, to be honest. So she's done her time, done her penance with Perth and Kinross, and this has been quite a challenging valedictory to write in many ways, because I know Sheena from one perspective, as a councillor on the other side of the learning families table, usually to her, and as provost. But usually when I'm doing these things, I try to gather as much information as I can from staff members and try and get funny stories, because they have a lot of funny stories. We don't tend to often get that many funny moments in the committee, but usually behind the scenes there are lots of funny stories to tell. And trying to get a funny story out of Sheena's colleagues was trying to get like blood out of stone. I think they were all terrified of getting lines from the head teacher, because apparently Sheena herself is an excellent storyteller, but she prefers, I think, to be the one telling the stories rather than be the subject of the story. And I think that's probably appropriate for Sheena's time with the council. Sheena is very much values driven and centred around education. If you were to cut Sheena open, which obviously we wouldn't want to do, but it would say education, 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 coming back to something that was mentioned earlier. Sheena is very much about the best opportunities and life chances, not just for young people, but actually that lifelong learning journey continues throughout careers of teachers and of everyone in her service as well. The story, and Sheena, I'm sure, will tell us much better stories than I can, and I'm looking forward to this famed storytelling that I've been told a lot about. But Sheena's story starts in 1984. Hopefully the most dystopian moment of your career was the COVID pandemic, but you may have some other ones, so we look forward to hearing about those, possibly some former conveners, you know, buried out the back when they've said the wrong thing in committee, perhaps, or provost, perhaps, even more. And one of the things that has been reflected by her colleagues from across the council is very much that Sheena is very careful, very exact, very precise, not surprising perhaps in a teacher, perhaps even less surprising in a head teacher, but actually that she thinks very carefully before she says anything, and I can certainly testify to that, because the famous words, "Thank you for the question, councillor," while Sheena decides to formulate exactly what answer she was going to give me to my awkward question, that would usually lead to us having a post-meeting discussion, but usually would end up with a positive outcome about whatever it was I was trying to get on the record on. There is some other reflections I've had from colleagues that Sheena is absolutely unflappable. And I think that we can all attest to because, and I said this at Learning Families last week, through the COVID pandemic, and a number of us were on the elected member sounding board, and were in, at least weekly, if not multiple times a week, meetings with senior officers. And through all of that, which was chaos in general going on in the country, but through all of that, Sheena never missed a beat when she was answering questions about her area, or indeed the wider area, because throughout her time in this council, Sheena has performed a number of roles, including service manager, executive director, strategic lead, and deputy chief executive through that time. But if we were to go back to Sheena's starting career, I think those fundamentals have stuck with her throughout, and the start of her career was very, very young, even younger than me. It was when she was a school child and was doing schoolies with her cousins and siblings, and they were her first pupils, or her experiments, depending on how you want to look at it, and set her up for a life of loving to teach other people and show them the benefits of education. Whether they were as grateful for that as she was, hard to know, and it's something we can both come together on, because I used to do the same thing to my younger sister, and I would add she went to Oxford, so I'm sure that it actually does some benefit in the long run, and we can maybe do a study at some point, of that. Sheena is incredibly well respected across the sector, and one of the things that has been reflected to me by senior officers in education and across the council is it's quite unusual to have someone at the absolute pinnacle of their area in what is a relatively medium-sized council. Usually we lose them to Scottish Government or to the national organisations, but Sheena's love of Perth and Kinross, and I think we can say it's been a love of Perth and Kinross because she has stayed here for 22 years. So, I think it'd be hard to say she doesn't love Perth and Kinross, has meant that we've had one of the most senior directors of education in Scotland. Indeed, she is currently the president of ADES, the Association of Directors of Education in Scotland. And that shows the respect that she's held and the esteem that she's held with in Scotland by her fellow colleagues across Scotland, her fellow 31 other directors of education. I think it would be hard to sort of not touch significantly on the COVID pandemic, because it was a significant part of Sheena's career, was leading, first of all, the closure of every school in Perth and Kinross, no small feat, the opening of key worker emergency hubs, which was a challenge. It may sound simple, but it was certainly not simple, trying to find staff that weren't at risk, and trying to plan out all of that through incredibly difficult regulations that were changing by the hour at some points. And then the reopening of schools and bringing young people and indeed their parents back into a very difficult environment, as well as the staff workforce, and keeping that confidence. And Sheena did that, I would say, by one of Sheena's traditional traits that I have noticed in Sheena, in her incredibly tight organisation. Sheena comes to everything incredibly well organised. Again, I would say the teacher in her probably, but she very much is always ready for what she is expecting. And coming back to that point earlier, unflappable. She does have a wicked sense of humour, but we don't usually get to see it except behind closed doors. But however, this being her last official formal council meeting, maybe she will show some of it to us and the public for the final time before she finishes with us. She spent 10 years as an associate assessor with HMI, and I think you'd have to be pretty terrified if you were on the receiving end of Sheena Devlin's inspection, perhaps. Not because Sheena is scary, but because you would know that she's going to pick up every little detail and be very supportive in how she was going to approach those issues, because that is Sheena's manner, but she will pick it up. I think it's worth reflecting that Sheena's values continue to drive Sheena all the way through. We had a Learning and Families meeting last week, and again, even at that point, a lot of what I certainly have come to see as Sheena's values, her social justice beliefs, very much were coming through at that point. And Sheena will be the first person to push back on elected members. Not always the most welcome thing if you're an elected member that wants to do something, but Sheena will push back on elected members who maybe have some great idea and point out some of the pitfalls of that, but explain to them why it is going to cause more problems possibly than it is going to solve. But she will do it in a caring and supportive manner, as you would expect from a teacher. So fundamentally, Sheena is a teacher at heart, I think, has been a teacher all the way through her career, despite her job title being something else, perhaps from time to time. And as one of her more recent pupils, I am very grateful for those lessons, even if I didn't seem so at the time, perhaps. And it's always great, you know, in hindsight, after the teacher has left, you'll be able to say, oh, I had such a good education from so-and-so many years down the line. So, Sheena, I think from all of us at Perth and Kinross, particularly the staff teams who work with you, who I know are facing up to a reality of a future working experience without Sheena and what that will mean. Thank you very much for all of your service. Thank you on behalf of all the pupils that you have taught in Perth and Kinross and further afield over those many years. And very much wishing you all the best for whatever you're going to choose to do next. I don't think this will be the last that we hear from you. I'm pretty confident that you will pop up in a setting or another in due course. And I think from the point of view of it's time for you perhaps to take a bit of time to enjoy the things that you enjoy doing, things like singing, and I understand that you were a great actress previously. You've performed in some fairly good productions in Dundee, and it is worth noting, you know, it's all about Perth and Kinross here, obviously, but it is worth noting that Sheena did serve for quite a few years in Dundee, and obviously has a family and a community in Dundee who also get to reflect on many of this, and hopefully we'll get to see a bit more of you as well. So thank you very much, Sheena. I'm going to pass over to Councillor Rebeck next as the convener of Learning and Families, and then Councillor Duff and Councillor Barrett have a few words to say as well.
Thank you, Provost. I'm glad you did a lot of the kind of formal stuff there, and well said as well. I'm at a slight disadvantage here for a couple of reasons, not least because I'm not used to being this far over in the chamber, and it's really unsettling me, quite frankly. They're no a bonny bunch, by the way. That's all I'm saying. And the second thing, and I'm kind of half serious with this, as a 61-year-old Scot, saying nice things about people doesn't come naturally. Dark humour and sarcasm's more our thing. However, I am delighted to at least try and say nice things, which are all genuine, about Sheena Devlin. Which would be strange if I didn't, to be fair. But but I will kind of touch upon a little bit, given that Xander's done some of the formal stuff here about, you know, the relationship I've had with you over the years, and it kind of fits into three different areas, I guess. But the first time I met you, I was not an elected member, and indeed it was maybe 17 or 18 years ago. I had two boys at a nursery who were a partner provider with Perth and Kinross Council. I think it's slightly differently done then than it is now, but effectively the council subsidised the particular nursery, and I didn't have to pay too much money for my boys to go there. Due to the quality of that nursery as it was perceived at the time, or the reality at the time, and I wouldn't name the nursery, the council stopped being a partner provider and called a public meeting. I was fairly grumpy, given that the fees were a way to double in price, and went along to the public meeting. And it was a good meeting, and there was lots discussed and whatnot. And I came back home not having got very far And my wife, who coincidentally also works with the council, asked me how it got on. I won't repeat the answer. It was bloody council, basically, along those lines anyway. However, I do remember saying to her, but the one lady there was pretty good. She knew what she was speaking about. And of course, that was Sheena Devlin, who knew, as Provost has already implied, had everything to hand, knew the answers to every question that was asked, and was very clear that she knew completely what she was speaking about. And that has been a common theme, frankly, throughout the 7.5 years I've been an elected member. The kind of next phase, if you like, was as opposition spokesperson for education in opposition, which I was for most of that 5 years, not quite all, but most of it. And I look back now and I think, what a pain in the unparliamentary language I must have been. I think enthusiasm at times got the better of me, and there were challenging times at that stage with school estate reviews and other things. But I have to say that the happy days indeed. But I do have to say that the relationship was always really respectful. It was really trustful. It was very clear, and the theme throughout this, it was very clear that Sheila knew exactly what she was speaking about, that anything that the administration were doing at the time was based on sense, and indeed was probably the right thing to do most of the time. I can say that now, of course. But there was also humour as well, actually, and I think you need that in life. You need a little bit of humour. I think that was important, but it was a very respectful relationship, even in opposition, as it were. And of course, we move on to the third phase of the relationship, which is more in partnership, if you like, as convener of Learning and Families. And the theme just continues. The knowledge that you have, the experience that you have, the way that you put things across, which is firm but respectful, is really impressive. And I think in summary, you're just best in class, quite frankly. I said on Wednesday last week, because we said some of this last week, that it's really important for a convener to have trust and respect for the strategic lead that they work with. I said at that time that I have 100% trust in anything you've told me that is that what you believe is correct, and I stand by that today. I did make my aforementioned boys chuckle a little bit, because last week I said that I had oodles of respect, and the PA printed that oodles of respect. My two asked me what oodles was. I don't think I've ever said that before in my life, so I don't know where that came from. So, loads, lots, whatever the appropriate word is, it was true. I'll just finish with a little bit of humour. The first time I put you, and this is confession time, the first time that I put your phone number in my phone, because I hadn't known you long, I had a temporary forgotten of your second name, and I'm thinking, what's Sheena's second name again? And I put it, and I thought, I'll put it in my phone and it's still there to this day, as Sheena the Big Education Kahuna, is how you're in my phone. And it's still there. And it wasn't that long ago that you phoned me in the car with the aforementioned two boys in the back coming back from football, and it gave them a great laugh to have this name appear on my phone book. But I think in summary, I will shut up now. I think I have thoroughly enjoyed genuinely working with you in whatever capacity over the 7.5 years. You will be a miss to Perth and Kinross Council. I have no doubt about that. I will miss you as well, but I wish you all the best and whatever comes ahead for you. Thank you.
Thank you, Sheena. I'd just like to add my comments to the many well-earned compliments that have been paid to you already today. Your service over your 22 years with Perth and Kinross Council has been exemplary, and your dedication to the children and young people and their education and nurture over that time has without doubt been outstanding. We worked closely together with each other during my time as Vice Convener on the then Lifelong Learning Committee, along with my colleague Councillor Shires as Convener. and I know that we valued your support, advice and guidance, both during that time and since then. I've always valued the personal support and guidance which you've offered to me as a councillor and as a group leader during my time with the council. During your 22 years as a teacher and council officer, you will have seen many changes, I'm sure, in the world of education. Education in Children's Services has by far the most extensive budget and the largest portfolio. And even during your time, there have been significant issues to wrestle with. Sorry, even during my time, there have been significant issues to wrestle with, such as the School Learning Estate Transformation Programme, early learning and childcare, the United Nations Convention on the Rights of a Child, the Tayside Regional Improvement Collaborative, the establishment of the very successful REACH initiative, the introduction of the curriculum for excellence, the creation of some new schools at Bertha Park, Riverside and Perth High, not to mention things like issues with the SQA and the recent strike action. However, nothing could have prepared you for the effects of the COVID pandemic, which had such a major and long-lasting consequences for education and for the pupils, teachers and families themselves. Over 4 years on, the impact of the virus is still being felt in a variety of ways within education. As has been said, your leadership of our educational response to COVID was typical of your hard work and total dedication in getting the job done. And while it was a very tough time, you helped this council to provide the best education possible under very trying and difficult circumstances for our staff and pupils. You're also a key mover and shaker for us both in Tayside and Scottish-wide education forums, and I know that you are highly respected and trusted within all levels of education and learning. Your skills and knowledge will be very difficult to replace. Now, last week at Learning and Families, Caroline rounded her tribute off with a little bit of Michael Mara. I'm afraid I'm more of a Burns fan, so if you'll permit me to paraphrase a little, here's my Burns quote for you. The friend of all, the friend of truth, the friend of age and guide of youth, few hearts like hers with virtue warmed, few heads with knowledge so informed. Sheena, I know you'll set off soon for Pastors New, and I'm sure you'll have lots of different paths to choose from. We wish you well for the best for the future, and I very much hope that you will stay in touch. Thank you for your service.
Sheena, you'll be pleased to know that I'm going to keep this mercifully brief. Thank you, thank you, Tommy. I had actually been hoping to find out what the first email that Bailey had sent to Sheena was. I don't know if we're going to find that out at some stage. I also want to demand full disclosure of John Rebeck's mobile phone book, because I hate to think what he's got my surname down as. I am aware that Sheena wants to leave Perth and Kinross Council with the minimum of fuss and the fewest toe-curling speeches the better, and far fewer farewell appearances than Elton John and Cher. So good luck with that, Sheena. But Sheena, with only a month to go and with your holidays and leave being taken into account, your opportunities for retribution, I think, are fairly slim, which means it's probably for me, safe for me to divulge a few secrets. But before I do that, I do have one or two confessions to make. Firstly, is that I feel something of a fraud when it comes to speaking about Sheena's contribution to Perth and Kinross Council, to young people and education and children's services in our area and nationally. And the new, improved, faster, better designed Councillor Barrett did that far more effectively than I did, than I will last week at Learning and Families Committee. I was, however, on the appointments panel when Sheena was promoted to Executive Director for Children's Services, so I did have a hand in enabling her leadership and improvement of the service. Also very grateful to Sheena for all the support that she's given me in my roles in COSLA, at COSLA Leaders, other COSLA leadership meetings, and as leader of the Liberal Democrat group on COSLA when having to engage with the First Minister, Deputy First Minister and Cabinet Secretaries on the thorny issues of teacher numbers, teacher census, pupil-teacher ratio, number of learning hours, trainee teacher places and probationary teacher placements and allocations, etc., etc. Sadly, despite all of Sheena's sage advice, it hasn't been possible to get the Scottish Government to shift 1 inch on any of those, but I would rather put that down to my own feelings as a politician rather than anything lacking from Sheena's comprehensive briefings. However, it has been fun to see how much irritation and trouble I could cause by repeatedly demanding what empirical evidence the Scottish Government had to support its positions, knowing full well that there was none. So today would seem to be like the right time to give proper credit to Sheena, because she was the original author and source of the empirical evidence line that I seized upon, dined out on, and took full credit for every time I used it at COSLA, in my budget speeches, at my party conference, and in press releases. I would, however, always drop Sheena a line to let her know where the latest empirical evidence bomb had most recently been dropped. So thank you very much for that, Sheena, and I do think that occasionally brought a chuckle to you. Sheena, I want to wish you all the very best for the future, which all the empirical evidence of your career, your abilities and personal attributes prove will be bright and interesting. Thank you and good luck.
So brevity, thy name is not Sheena, so buckle up. I would say this is absolutely, as we say in Dundee, murder. I am genuinely a very private person and far prefer to be the giver of information or share in people's, important events rather than be the focus. However, I did say, I think on Wednesday at Lifelong Learning, this was something I would have to endure and endure it, so I will. I don't know if you've picked up though that I was a teacher. I think Sander mentioned that a couple of times in his speech today and last Wednesday. And you know, I'm fine with that, because actually being entrusted with other people's children and young people, I genuinely believe is one of the greatest privileges that anybody can be afforded. And it's also the second time in 2 weeks, so nearly as frequent as some buses that run up the cars, that Xander has admitted that he's learned a thing or two from me. So my work is done here. Unknown facts about directors of education or former executive director of education. I think I'm probably the only one that also holds an equity card. I might dust that down and go for a few auditions and see what happens. But please just be grateful that I have not brought my accordion today to give you all a tune, because that would certainly clear the room very quickly. John, thank you very much for that Burns quote. I know that quote very well. I'm just really glad that it wasn't a quote from Tua Haggis that you decided to share with everybody today. And Peter, Kathleen Baird has been in touch. Former councillor Kathleen Baird has also been in touch today that she'd say that she'd heard about my news, and she can trump you in terms of appointment panels, because Kathleen was on the appointment panel when I got the job as head teacher at Dumbarnie Primary, which wasn't today nor yesterday. But moving on, I do want to say just a few words, if I may. Democracy and justice mean different things to different people, and we only need to look around the world just now to see how true that is. And so too it is for the word education. So for me, education is one of the greatest human endeavours that anybody can be involved in. For me, it's an organised system of learning, and it's also a really important social construct. And if you've been at Lifelong Learning Committee even once, you will have likely heard me say that. And we saw that writ large during the pandemic, and we see it still writ large post the pandemic. But for an organised learning system to flourish and have the expected outcomes that we want, it needs a wide range of people and services to work together, all with an agreed purpose. And I can genuinely say that it has been my privilege to work with a wide range of talented, creative, tenacious, caring and innovative people across 2 different local authorities and various organisations nationally in my 36 years of public service. And I include in that the conveners and the vice conveners, past and present, who it has been my privilege to serve underneath. As a teacher, a deputy head teacher, a head teacher, a professional advisor to the then Scottish Executive, as an inspector of schools, as a service manager, a head of service, a director, an exec director, and now a strategic lead, and also president of ADES, I have always and only cared about doing that which is right and what is just. And in doing that, alongside all who share in that ambition of improving lives together, the strapline that we have in education and learning. I hope and think that I have sought only to give hope and optimism to our young people and never to restrict or to patronise with pity or with platitudes. And it has been a source of pleasure and pride for me that so many former pupils and their parents and their grandparents and their aunties and uncles and so on still keep in touch with me from all different parts of the world. And I'm always delighted to meet them, whether that's online or in person. But sometimes it can be quite an uncomfortable experience, as happened not that long ago in a shop not that far from here. Vanilla Hair and Beauty, I think it's in South Methven Street. And I'd made an appointment, and this is maybe TMI, sorry, for a full leg and bikini wax. Went in, only to be met with a former pupil, so we both quickly agreed that a half leg below the knee wax would be far preferable an experience for both of us on that day. That would have just been a step too far, I think, for both of us there. But I also have taken, because people associate me, I think, with schools and education, but I also take great pleasure in continuing to hear and meet about the successes and the experience of our FYI young people over a long period of time, our fun young individuals, the care experienced young people here in Perth and Kinross, and also all the young people that it's been my privilege and pleasure to work with through our youth services team. In fact, I had breakfast along at Scott Street this morning with a number of colleagues there, and we were just talking about a whole range of different things, and that whole bit about me being unflappable came up, and I was reminded that one of my predecessors was probably a bit less unflappable than I was, and it wasn't unusual for her to take off one of her shoes and just hit folk to get their attention from time to time. I'm really pleased to say that I have never ever done that. Sometimes felt like it, never done it. But seeing our young people succeed, regardless of what it is they go into, we've had a number, I've certainly had a number of my former pupils have gone on to be head teachers here in Perth and Kinross. I know you're all thinking I'm not old enough. Yes, I am, and that has happened. I've had young people who have gone on to be soloists with the Scottish Chamber Orchestra. And it's really a privilege to be invited along to some of these things. Singers and bands, modern apprentices, children's rights officers here in Perth and Kinross. And in fact, it's been a great pleasure to very recently be working together with one of our former FYI young people with Aviva in terms of deciding about where Aviva Trust monies go, reinvested into Perth and Kinross. So all of that has given me real pleasure. However, what will continue to drive the work that I will do beyond my time in Perth and Kinross is that I know that our collective endeavours are not always as successful for all of our young people as we would like them to be. And so as I move on to as yet unknown but new opportunities, and probably just want to say for the record that this is about me having resigned from Perth and Kinross, not having retired, just in the words of Bruce Springsteen, this gun's for hire. So if anybody's watching and there are opportunities that folk want to talk to me about, then very happy to do that. But I am clear that the drive for me in whatever comes next will be coming from not the successes that I've seen in children and young people, but from those that we know we still have to do better by. So thank you very much.
Councillor Rebeck has a small token of our appreciation, Sheena, on behalf of the council. Thank you very much, everyone. I'm sure you will perhaps want to say personal goodbyes to Sheena either today or in the next couple of weeks before she doesn't disappear quite often to the far distance. But I would just remind members, please do head through to Civic Hall if you're able to for the City of Sanctuary celebration.